Hi, Sarah. Hi, Wilf. It's nice to be back. And, we've done 65 million tests since the beginning of the pandemic. If you look right now, we're doing anywhere from 125,000 to 175,000 per day. And the good news is that we're able to turn those tests around on average within 2 days. If you look at Pixel, there'll be more to order tomorrow for sure. What we try to do is make them available throughout the day, and then we make sure that we can actually have them shipped in times that we get them the next day. But Pixel remains a very important testing capability that we have, and it represents still about 5 to 10% of the total tests that we do.
Yeah, no, I've been doing Pixel with you, ordering it at home for a while now, in what seems like over a year. So how is the White House doing? Have you had any interactions with this new testing advisor when it comes to better pricing and better availability of tests, which we so desperately need?
Yeah, so we've had discussions with the White House, and those discussions are very positive. They're very good. What we're trying to do is make sure that we have the capacity available for the types of tests that we run. We run tests that are in central laboratories. They're the PCR tests. They're considered still the gold standard. Right now, we're running 125 to 175,000 per day, but we can do more if we need to. So we're preparing for any situation. The other thing that we do is we provide our tests with no upfront out-of-pocket costs for any of the patients. So if you go to your physicians, if you go to an urgent care, you can get these tests done, and we provide them with no upfront out-of-pocket costs.
Adam, in terms of your outlook for sales of COVID tests in the year ahead, do you expect it to fall dramatically compared to last year?
Yeah, I would expect that sales will go down this year versus last year. But to be honest with you, I expected 2021 to be down even further than it was. It's still so hard to predict exactly what's going to happen during the pandemic. So, we're going to be prepared for whatever scenario comes forward. Back in June of last year, people said, well, you're not doing that many tests. Are you going to keep your labs open? Are you going to keep the capacity where it is? We did that. And I was really glad we did, because when we needed that capacity in November, December, and now we have it. That's why our turnaround time remains under 2 days. So even if the number of tests go down that we're going to do in 2022, we'll be prepared for whatever scenario comes forward.
What about the White House policy, the Biden policy of requiring health insurers to pick up the cost of the test? You said it's free at providers, but if you're buying it at the store, now theoretically, if you have private insurance, they should pick up the bill. Is that going to be effective? Are they going to pay you directly? And do you think that White House has authority to do that?
Well, I think we have to do everything we can to make the test as readily available to everybody that needs to be tested. And we do need significant numbers of tests, particularly if you think about the rapid antigen tests that people can take at home. So whatever we can do to encourage people to get the tests when they need them, I think we have to do that. I think industry working together with public and private relationships and with the White House has to do everything we can to help the country and, frankly, the world through the pandemic.
Adam, what are your hopes more specifically for other medical demand to pick up if Omicron does subside, and how that will play out in terms of your earnings and revenues? Which areas in particular?
Yeah, so if you look at our base business, it continues to perform very well. At Labcorp, we run tests for cancer, for Alzheimer's disease, for diabetes, for cholesterol, almost every type of test that you can imagine. And if you look at the level of testing we're doing today, it's almost the same as it was prior to the pandemic. We're going to continue to make those tests available. At the same time, a big part of our business is in drug development and running clinical trials. And if you look at clinical trials, there are many that are ongoing right now outside of COVID. So we're going to continue that momentum. And we're going to provide our earnings guidance for 2021, for 2022, and we're going to give a longer-term outlook on February 10th. I look forward to providing that because I'm optimistic about our growth opportunities before us.
Adam, thanks for joining us again. Good to see you.
Yeah, nice to see you both, too.